rejuvenation and prolonging overnight beyond the normal span. So, an internal spending.
Welcome everyone to the 39th Silver Moodoo session. Today's session will be led by Townsend SBN, who will be discussing balance, after which Andrew Cheever SBN will give a brief presentation on acupressure points.
출연 국기발에 바로 묵형 바로 서범님께 형님
안녕하십니까.
안녕하십니까.
Great to see everybody. Great to be part of this. Let's begin.
Yes, sir.
Sure. Thank you, SBN. It's an honor to be here with everyone. Please, the first part of this will be a little bit of lecture, so if you would like to have a seat, and then seniors, thank you for being here. Whatever you'd like to offer, or if you'd like to participate, that's up to you. Thank you for being here. My name is Townsend. I'm in Oklahoma, Region 6. I am honored to be able to serve as a regional examiner, as a board director, and as a TAC assistant. And my instructor is Hockman SBN. And I've learned a lot from him as he was dealing with challenges as he was training as well. So when I first started training with Hockman SBN 33 years ago, very dynamic kicker, active, and as time went on and injuries occurred, watching him go through knee surgeries and hip surgeries and how he handled that with Shimgung helped me when I started running into back injuries and things like that, because it painted a model that I could follow. Without watching him traverse that with Shimgung, it would have been a lot more difficult for me to understand how to handle moving through this. And I probably would have just resigned to I can't do that anymore. I'm going to go do something else. So want to give, the examples that we set as we go through that, just like my instructor, really help out those that come behind us, even if we don't see that. So balance. The theme is balance, and hold your head as if suspended by a string. Pretty simple concept on the surface, but as we go through different seasons of life, that presents different challenges, right? And so the idea of holding our heads as if suspended by a string is a great concept, but how do we accomplish that? So in today's session, we're going to go through some ways to accomplish that. And there may be some things that work depending on your stage of life or any injuries that you have, some things that might not, or maybe you have something to share with the group that can help. But we want to go through first talking about Shimgung and how that plays a part of it, and then to the physical aspect that we typically think of first. So the season of life that we're in, depending on where we're at, we've already had to overcome certain setbacks. And those setbacks could be emotional or family related. They could be physical related, injuries, sickness, whatever. Some of those are temporary and some of those are minor, but others may be more debilitating and possibly permanent. But I think it's important for us to understand that those setbacks don't define who we are. Instead, they offer an opportunity for us to overcome and strengthen our resolve. And that's where our Shimgung comes into play. So our Shimgung gets strengthened by things that require us to look past what's happening to us currently and focus on the future. Whenever we do that, it allows us the opportunity to establish a connection with others, to either learn from others or help others do the same. So a good example is the Silver Moodoo group. What an amazing initiative and participation. And then we have the youth leaders, right? And so being able to learn from each other and provide guidance and light the path for the future is important, because especially for youth leaders, they may not have had to overcome any challenges yet. And so they can get by on natural ability, talent, lack of injuries. But when things start happening in later seasons of life, they're going to need the guidance from the senior members to help them overcome that, because they could be setting their identity in what they can do physically. And if that's where their identity is set, when they can no longer do that or have to adjust that, it could be debilitating to not only to their training, but to how they view themselves. So what we can do is make sure that everyone understands that they provide value regardless of the season of life and regardless of any injuries that may be hurting them either temporarily or permanent. So challenges, again, aren't labels, they're problems to solve. And then mental reps of positive thinking help establish a good foundation and outlook for when challenges come. So I'm a perfectionist myself. I'm pretty negative, hold myself to a higher standard, and I have to be really cognizant of that and work toward positive mental reps. You know, you can do this. We've done this before. Here's a challenge. Here's how we're going to overcome that. And so I think, you know, as long as we focus on this part of this will allow us to work on the other parts that help us achieve balance. Shimgung, when we work on Shimgung and the challenges that we face, Shimgung doesn't allow room for doubt or excuses for that matter, but instead it focuses on execution of the plan. And so that plan could be something like, maybe it's something that we worked with our doctors on. I've had back injuries, and I go through that almost every year or every other year. I'll do something that has a setback. Sometimes that limits my movement. Sometimes it makes part of my leg go numb. And when you're trying to teach and you can't feel your toes, trying to get balance in that can be challenging. And it's challenging from a physical perspective, but also a mental perspective as you try to set the example. All of us here have gone through challenges and are going through challenges now. Some are more severe, but I think, you know, as we focus on what we can do, working with our doctors, physical therapists, and set a plan for achieving regardless of those challenges, I think that's where our Shimgung really steps up, especially in this stage of our life. I think Shimgung becomes a lot more dominant, which is the core for everything else. Balance is needed because it's the foundation for proper execution. So without balance in our physical aspect, we can't execute a technique properly. We can't move properly or safely. Balance in our lives mentally, same type of thing. If we get too one-sided on one thing or another, we're not thinking clearly. We can't make good decisions. So balance is a very important part of not only our Weigong, but also our Neigong and our Shimgung aspects of our training. And everyone here understands that, but I think that it's important to go back and talk through that. Just some affirmation as to there's always a path forward and a way to execute, and that we provide value regardless of what we can do physically. So some of the tips that can help with balance is to keep training. Right? So exercise is important based on what we can do. Sometimes my back will get really stiff and I can't move very much, so I try to figure out something else. Maybe it's stretching, maybe it's pre-stretching before we train, but finding some way to keep moving, especially for those of us that suffer with arthritis, attacking the joints. If we lose the muscle structure around the joints, then we put more pressure on the joints. You know, it's kind of a catch-22. If it hurts to move, we stop moving. When we stop moving, we have atrophy. When we have atrophy, there's more pressure on that. So it's finding ways to keep moving and find the hidden reps in everyday things. So a couple of tips for that. Squats are great. Weight-free squats help with our base, help with our balance, help with the strength. If we can't do squats, sitting up out of a chair without pushing off. So A lot of us, myself included, we push off of chairs when we stand up. I work at a desk job full time, so that causes, shortening of hip flexors and things that you have to be aware of. But little things like standing up from a chair without pushing off the seat or the handrest are other ways to help keep your hips strong and your knees and quads strong. And that helps, that's going to help you not only with your strength and your joint pain, but also with balance, because you're going to need those muscles and the ability to flex those joints in order to maintain balance. So squats, bridges, I don't know if everyone knows what a bridge is, but we'll do a couple of those when we warm up. But you lay on your back and then you lift your pelvis up to try to create a straight line and then back down. That helps strengthen your back and your glutes to help support your lower back, because all these things tie into holding our head as if suspended by a string. And a couple of examples is if our hip flexors are tight or our back is hurt, sometimes we tend to lean forward. Well, when we lean forward, we can't hold our head as if suspended by a string, right? So that suspended by a string, that concept of movement and keeping our line straight and keeping our posture straight, it all ties into all these foundational things that help support the end goal, right? Are there any questions before? I know this is just a quick lecture, but is there any questions before we get into some movement? And when we get into the movement, if there's anything that you're not supposed to do or your doctor tells you not to do or you're not able to do, just do whatever you think is possible or take mental notes, whatever works best for where you are with your injury. So a couple things to warm up. We're just going to lift our legs up, knees up, and we're going to work on balance when we do that. Some keys to maintaining balance are keeping our shisun on the horizon. Part of that shimgung ties into that. When we're feeling down, our posture will be forward, our eyes may be down, but we need to straighten our spine, keep our eyes up. The other thing is, every joint that we can flex for our support, we need to do that. So whether it's the balls of our feet, or it's our ankles, knees, hips, everything is involved to help us maintain our balance. So if we stand here, just relax, and then lift up our left knee in front, if you can do that. If you need to hold a chair, that's fine. So if our leg is straight on our base, it's hard to hold that. But if we can bend our knee and bend our ankle, if we're allowed to do that, tighten our core. We don't want to rest on our spine. We want to tighten our core to hold this, to support our spine. We can hold balance. Whenever we start losing those points of flexion, balance becomes more difficult. So wherever you are with, you might have neuropathy or you might have an injury, you're going to have to focus more on the other flex points to try to achieve that. So whatever works for you, but we're going to go ahead and lift your knee up, your left knee up, and hold it. Hana, dul, set, net, dasit. Slowly raise it or lower it. Now your right knee, lifting it up. Hana, dul, set, net, dasit, and down. We're going to go back and forth. Hana, dul, set, net, dasit. Hana, dul, set, net, dasit. And you want to control your body at all times with your muscle. Anytime we get tired and start to leverage our joints to hold us up, we need to find a different way. Because at that point, we're not getting stronger, we're actually starting to damage things. We spread our feet just a little bit, and now we're going to rock side to side. We're going to go to our left side first, bending our left knee, okay. And then we're going to go to the right. Back and forth, slowly get the movement. And then try to think about, as we keep our head as suspended by a string, keep our shisun up, and let's not let our head raise up and down. We're just going to go side to side, keeping our head level. Stepping out a little further, squatting, same thing. Just rocking side to side. Our core is tight. Our eyes are up. Sink a little lower. Okay, now straighten our stance. We're going to walk up. Feet close together, hands on our knees, bending at the knee. Hana, dul, set, net, dasit, yasit, ilga, yudul, ahap, yul. Straighten the legs. Keep your back straight. So we talked about this during the mobility class, but anytime we're stretching, the goal is not to touch our toes. The goal is to bend at the waist, keeping our back straight. If we turn and we bend our back to touch our toes, that's detrimental to our lower back. So we want to keep our back straight and then just let gravity help us pull that down. And then straighten your spine, spread your feet. Down in the center, same thing, back straight. If you're not sure how to, if you're keeping your back straight, you can grab a staff or a broom handle and hold it behind your back to where it's along your spine, and then bend that way, keeping your pelvis and your head and your back onto the staff. Now, heels in, lower your hips, arms on the inside of the knees, keep your back straight, eyes up, lower your hips. And just kind of rock side to side a little bit. And slowly come up. Now we're going to go into a lunge position if you can. Stretching down, but we don't want to go down too far. So this lunge position, we're just going to bend our knee a little bit. Now, we want our hip, we're going to choke and tilt our pelvis up. When we do that, you're going to feel a strain on your hip flexor and on your quad. So, other hand can rest on your hip, but the hand that's on the same side as the leg that's back, you're going to bring that straight up and above you, and you should feel that stretch on the front of that hip. And then you're going to lean toward the back. So, from the side view, it's here. I've raised this up, arm up, and I'm just going to lean to the other side, and you're going to feel that stretch and hold it. When my sciatica is acting up, or whenever I start having issues with my nerves and my legs, this will light it all up. And on that T-band and on that hip flexor, just hold that and let it stretch. Sitting down is the worst thing for us in regards to our hip flexors and our lower back. So we need to stretch that back out. Okay, now hand in front, carefully expand, breathing in and out. Now we're going to go in the other direction. Same type of posture. Roll your pelvis up. Tilt this up. Hand comes up. You can feel that in the front of your hip flexor. And then lean back. And for those of you that maybe you can't hold this posture, you can hold a chair. Or maybe if you're having to sit in a chair, if you can get one leg to the side and then push on that, roll that hip up, push on that so you can feel it on the hip flexor. And then moving back this way. Okay. Now hand back out in front. Breathing in, expand. And back in front. Okay. So these are some exercises I do to get my back ready for training. Even before we do the Mudo Value warm-ups, I have to do these so that my back is ready to go. The next thing we'll do are hip 90-90s. So on the hip 90-90, if you are able to do them, they're really great for your sciatica and your lower back. Some of us may have had surgeries where doctors have told us not to do this. If it's possible, to sit in a chair and then pull your leg over on top of the other knee. You can pull this up if your doctor allows for that. Some of us that have had hip surgeries may not be able to do that yet, but this will help with your sciatica, relieving the pressure on that from a muscle standpoint. If you can, sit on the ground and then turn to the side, and you're going to have one leg sticking out in front 90 degrees and then to the side 90 degrees, and the other one to the side and then back. But 90 degrees is important. If that's too challenging, you can bring these in just a little bit to allow you to sit up easier, but your goal is to have this at 90 degrees. Then we're going to straighten our spine, leaning over the front leg, stretching this way. Breathe in, relax, and out. Slowly come up, straighten our spine. We're going to turn toward the back. And now, we're going to straighten our spine. Well, our spine should already be straight. We're going to untwist, turn to the side here. And try to stretch this. This is going to help you with your hip mobility, which is all important for balance. What we're doing is working on our range of motion that allows us more tools, basically, or more range, so that we can achieve balance a little bit easier. Now, if you can, do it without touching the ground. If you have to, reach behind you. But we're going to pivot with our heels on the ground over to the other direction. And then we're sitting in this posture. We'll lean over this leg. Breathe in, out, and straighten up, turn to the rear, and then straight, and then to the side. Now again, if you can do this without touching the ground, that's great. If you have to touch the ground, that's fine. Try to leave your heels on the ground and then pivot to the other side. And then pivot again. And then back and forth a couple of times if you can. And then we're going to stand up. So standing up, there's a few things that you can do to keep your body in good alignment when you stand up. Kenyon Salvanen talked about this a couple of months ago. But if you're in a hip 90-90 position, one thing you can do is just push your hip forward to come up on this knee here. And then you can bring this leg across, present this leg, and then stand up with both legs. Another way, if you're in a seated position, is to extend the leg out in front, hand on the ground, push forward to come up on this knee, and then same thing. Then you can stand up with both legs. And then one that may be a little bit more challenging, but if you have to go backwards, same kind of thing. Hand here, hand out here. You're going to kick behind you and then stand up. So there's a couple ways to stand up, but what you don't want to do is stand up like this. And the reason you don't want to do that is, one, it's not a good posture to be in from a self-defense perspective, but two, you're putting different kinds of strain on your back that you don't want, right? There are on your own training, there are bridges that you can do to help strengthen your core and your lower back. All these things are important not only for your balance, but just longevity and protecting your back. All right, chin B. Arms out to the side, palms facing away. We're going to roll small circles to the front. And then stop, and then small circles to the back. As we continue to warm up our shoulders, we're going to make the circles bigger. Okay, and then back to the front, bigger circles. And then as you can, create the biggest range you can with your arms without changing your posture. Keep your posture straight. Core is tight all the time to protect your back. Okay, and then to the back. Elbows out, twisting to your left and then to your right. When you twist, your back is an amazing thing. It can do a lot of different things, but it's not good at doing two things at the same time. So when we twist, we want to twist, keep our spine straight, our head as if suspended by a string, right? And then turn, but keep your back straight. Be careful not to lean when you turn. Okay, you want to keep this straight. Let your feet pivot to reduce the pressure on your lower back so that you can get a good twist out of this, and you can work on your hips and your twisting, some lower back, but not a lot of stress on it. Ready? We're going to start with our left and then go to the right. Hana. Tul. Set. Net. And bottom. Show. Go back, Townsend. So for balance, we're going to do a couple of basics, and then we're going to go into Subakdo Gicho. The basics we're going to focus on are going to be Haran Maki and Chungdong Kungyuk. And when we look at balance on how to do this correctly, we want to make sure that our posture is correct, our stance is correct, and we focus on what the Umyang has as far as, or Umyang, as far as the yang coming out, the coming back, balance in equal parts so that we maintain a good posture and good structure. With balance, one of the keys is, the basic principles of balance are, you want your center of gravity, which is around your danjin, in between or over your points. If you look in volume 1, there's in the section, I think it's page 145, it's the section that talks about stance and posture, and it talks about balance. And one of the things that it mentions is, with the wide horse stance, for example, now my support is further out, which allows for a wider range, and I have more balance. If you're on one leg, you have less balance because now I have to go over this one point. So very basic concepts, but our jase is very important in how we keep our balance. So Chungul jase, for example, we're going to have, everyone knows this, but we're going to go back through it. Our feet should be shoulder width apart, and we should have a good bend in the front knee. Our back should be straight. If our hip flexors are too tight, or our back is tight, or both, we'll end up leaning forward. Okay. The problem with that is that A, we don't have good balance here. We can't hold our head as if suspended by a string, and that's actually going to continue to do damage and strain on our back. So we really have to think about tucking our core, pushing our huri forward so that we now have a good posture to sit on. Okay? This is also, if this is tight, this is also a good stretch for your hip flexor. Here. So maintaining a proper posture is going to help with that. These are all things that we need to keep our head as if suspended by a string. So, chumbi, stepping forward left, haran maki. And when we step forward left, we typically will think about either the weapon or the block that's going forward. And we don't put enough emphasis on the hand that's coming back to chamber. We need to keep that balance so that when we move forward, our spine is straight, Shisun's up, and the same amount of effort that's going forward is going back. 준비. Step forward left. 하단 마키. 하나. two. We're gonna do 3 techniques forward and then 3 techniques back, so we get a few reps in. Think about the retreating hand on this. The expansion, contraction, huderi, all that's involved, but really focus on this retreating hand so that we can maintain balance. Duo. Set. And now, if you need to, you can back up to do a few more, or dwiro, haran maki, tora, tea. And then 2 more. Hana, 둘, dwiro, haran maki, tora. Good. So maintaining that balance is going to open up a lot of things for us, right? Where our posture is good, our endurance will improve, and the techniques that we throw will be more effective. So now we're going to go to Chungdan Kongyuk. Chungdan Kongyuk, same thing. If we focus on the strike, we'll tend to lean forward. Okay? What we need to do is focus on both, so that we maintain our posture. Very important. 준비. Stepping forward, 하단 마키. 하나, two. Stepping forward left. Okay. Now, 중단 공격, 중단 공격. Keep the balance. 하나, 둘, 셋, 뒤로 하단 마키, 돌아. 중단 공격. 하나, 둘, 셋. 뒤로 하단 마키, 돌아. And 바로. So very basic concepts, but there's a lot of depth. If you're having trouble with hyung or with any type of movement, go back to the basics. Work your concepts: contraction, expansion, huderi movement. Hold your head as if suspended by a string. So back has to be straight for that. Jase has to be correct for that. Your posture and your motion needs to be balanced for that. And then don't raise up and down. Keep your height the same. So to do all these things requires flexion, requires strength, and requires thought into, intention, putting into your technique instead of just kind of going with what you've always done. We're going to move into a couple of Subakdo Gicho that's really going to emphasize this. So the first one, we're going to do John Kapkwan Kumgyuk. So John Kapkwan, some of the challenges around John Kapkwan is stepping too narrow or leaning forward. Those are 2 of the biggest things that I've seen where people have had trouble with this technique. So I'll demonstrate and then we'll talk through just a couple of things on that and get a bunch of reps in. John Kapkwan Kumgyuk. So 2 things with that. One, again, as we move, try to keep your head level. Whenever you step forward, if we straighten this leg out, we'll tend to raise up and fall. We don't want that. So what we want to do instead, when we move up, is you keep this bent, keep your head level. When we step forward, it allows you to push forward, keeping your back straight and your head at the same height. Okay, let's make some room for a couple of reps. Chumbi. Stepping forward, Wenjak, left, Haran Maki. Hana. Jong Kapkwan Kungyuk. Jong Kapkwan Kungyuk. Hana. Now, how's your line? Are you leaning forward? Is your base correct? Dul. One more. Set. Do we roll? Turning with Jong Kapkwan Kungyuk. Tora. Hana. Do we roll? Haran Maki. Tora. And Baro. Okay, good. Couple points on this. When you are moving forward to do the next technique, you want to chuk, which brings this in. So bring this in with the chuk. And then as you move forward, this will push, the hip is going to push and unwind this. At the same time, it draws this back. So it's more that motion and less this motion. Okay. So that second motion doesn't really follow our process with that, and it makes it more difficult. The first motion is more balanced. You're able to hold your head. You're able to extend and get the proper line. So work on, if you're having trouble with that, a couple of key points is just, this is my center line. I'm going to move up. This is going to kind of come in front across, the elbows are close. And then as my hip moves, this that's on one side of the center line is going to come back to it. This is going to go all the way through both, 1, 2 to the back to get that line. And your back needs to be straight. Okay. We'll add the hua cook to that, and then we'll be pretty close on time. We may cover one more. So for hua cook Jong Kapkwan, if your spine is straight and your head is held up and you have your balance, hua cook becomes easy. If your foundation isn't right or you're leaning forward, hua cook becomes more challenging. It's a great test to see how your line is on the first. So, for example, if I'm leaning forward, when I go to do the hua cook, this becomes more challenging for me. If my spine is straight, but I'm in a line this way, or my feet are in a line, this becomes more challenging for me to get that second line. To do both of those, it becomes very challenging. For me personally, it's painful because my lower back is under a lot of strain with that. So you want to make sure to keep your base wide, shoulder width apart, back straight, head up. When you pull, keep this line, pivot on the back heel, and then push across. Don't lean forward, just push across and get the line again. Okay, Chumbi. Step back to make room for some reps. Stepping forward, left, Haran Maki. Hana. Okay. All right. Hua Cook Jong Kap Kwan. Hana. Dul. Do we have room for one? Make room for one more. Set. Baro. And then we'll back up. I saw a couple of you still leaning. So when you're here and you go to contract, you're contracting, but you're leaning forward. You don't have to lean forward to contract. So when you contract, just contract this, and then, just like in pole wall, it contracts in, but you don't have to lean. That allows for this motion to be a lot more natural, because you're just kind of unwinding it. When you contract and you lean forward and your spine isn't right, you're going to end up using more muscle to overcome that, and that's not what we want. Let's get a couple more reps. Think about the line, right? And think about your posture as you move forward, and I guarantee you it'll make this a lot more enjoyable. Okay, so Chumbi, step forward left, Haran Maki, Hana. Okay. Wakuk Jong Kap Kwan, Hana. Very nice, Tumi Sabadim. Good posture. Dual. Good. Make room for one more. Set. Good. And Baro. So I don't know about where you are with your injuries and movement, but I know for me that whenever I'd hurt my back, this motion was very challenging for me. So I really had to go back and break it down into steps, and that's what I'm sharing with you today, is how I'm able to do it in the right way, but also to preserve your back. If we're working on our Subak Do and it hurts us, we may have some injuries that we need to take care of, work with the doctor, physical therapy and all that. But outside of that, if we're hurting ourselves doing the art, we're probably doing it wrong, right? So we really want to focus on what are the proper steps and what's the process to do it the right way. And the right way is going to be different in some cases on a micro level between all of us. It's what is the philosophy that the founder and the Kwangjenim has and that we're taught? What is the process that we're taught? And then the micro is, what is my body capable of doing at this stage in my life? And how do I incorporate that into the process? So I apologize for talking so much in this class, not getting a lot of reps in, but I wanted to give you something to take away that you can work on your own and find your own micro processes to help with your posture. And then next up will be Cheever SBN to work on some pressure points. Thank you, SBN. Thank you for the opportunity.
Thank you very much, sir. Always good. All right. All right, I'm going to bring up Senator Cheever here. Spotlight for everyone. Welcome, sir. Good to see you.
Hello. Can everyone hear me and see me okay?
Yes, you sound great. Perfect.
And let's see. I think I might just share my screen if that's all right. I have some slides. Thank you for inviting me. And I will say there's so much experience and expertise in this group. So I don't pretend to have anything prescriptive in this, but I just share a little bit the way I think about some things as an acupuncturist. And most important is, if you have any questions or follow-ups, please contact me. That's my email address. I can send you these slides, or if you're curious about trying acupuncture, the acupuncturist close to you, I'm happy to kind of support or answer any questions there. And I'm just going to try to fly through quick, like 3 different points that maybe use for acupressure. Is, again, these are just the ways some points I think about in terms of balance and practicing Subak Do and wellness. So the first one, maybe you heard of kidney 1, Yongchuan, we call it sometimes. And if you can see that picture there, where it is about 2/3, or like the way the foot is split up into thirds there. So just for me, when I'm thinking about standing in the center of my foot, or balance between 2 feet, or connecting to that earth energy, that kidney 1 point is something I visualize for my balance. And then as far as acupressure, well, sort of like listed a bunch of things it's good there for. I will say most frequently in the clinic, if someone is having symptoms of like too much rising, like rising yang, they're a little dizzy or woozy, or they're have like a kind of stress or anxiety up in their head and their shoulders, that kind of tension. Sometimes a little acupressure and encouraging them to breathe through their feet, breathe through kidney 1. I might hold my thumbs on each foot, encourage them to like breathe down. We kind of know this from our own practice about connecting into the earth energy, breathing through our feet, kind of like that downward and grounding. So could be beneficial for a bunch of different things. Just a quick overview there. All right, flying through. Bai Hui, maybe you heard of this one. We're talking about head suspended by a string. So I think about this point about how it's really on the crown of the head. I don't know if you ever have students when you say like, keep your head straight, and they put their nose or their chin up. And really we're trying to visualize it's more like that headband. It's like a my GV20 is usually how I chart it in for patients. So we're thinking about that for like a rising, that head suspended by the string. So kidney 1, grounded, earth energy, nice balance on the floor, and then GV20 like a rising. That's at least as I visualize, that's where I imagine the string is attached to my head. And so as like clinical application, this could be the other way. Sometimes if people are like blue or down, or even the spine is compressed, we could do a GV20 point as like a lifting, as a rising. If you know the kind of like the breathing exercises where we have Du Mai in the back and Ren Mai in the front, we have that kind of like breathing cycle. But we could also needle this point as a way to send the energy back down to continue this cycle. Du Mai is Governor Vessel is the meridian that kind of goes up through the spine and circles around to like the Incheon area. Yeah, I try to leave some time for questions at the end because I know this is very fast, but I can send you these slides. And then the point you've probably heard of, Hugu. This is the like headache point that you hear about sometimes. So I don't know if you can see in these pictures, my like pro tip as an acupuncturist is sometimes I think people are massaging their that muscle there, which feels good. And especially on the hand, if you're using your phone or typing or doing a lot of work with your hand, massaging that muscle in there can feel very good, can be beneficial. If you're trying to get the acupuncture point, you want to really find the center of that bone there, let me see if I remember my anatomy. That's the carpal bone, right? You can see in the picture. Find the center there. And I tried to show in this picture here with the guide tube, you're aiming almost under that bone, like across the hand. So if you have a headache, I mean, this point is really good for any kind of stuckness. So sometimes if people come in and, how can I put this delicately, their digestion is a little slow, we might do this point to try to get things moving, that sort of thing. So again, if you're doing this point or any other point with the acupressure, I tried to measure how much on my little kitchen scale, just like 1 pound of pressure. When I pushed up to 2 pounds, I was already like, that's too much. Just enough to stimulate the point. I think sometimes people get excited, or maybe they are in pain or uncomfortable, and they start wailing on things. And in my experience, that's not necessary, just enough to kind of like stimulate. So those are the 3 points I had. Again, here's my email address, or even if you want to field any questions now, those are just a few spots about grounding through the feet, kidney 1, visualizing where GV20 is, and then there's 100 points you could do for acupressure, but this most common one you've probably heard of actually is good for just clearing stagnation, getting things moving. So good for all sorts of pain. But I'll leave it there, Sabanim, and if people have questions or you want me to review, or I can share the slides, but that was my like way too fast overview.
Thank you, sir. Okay, so the first question I have, I know a lot of people here are familiar, like you say, with these types of treatments to an extent, but you're an expert at it, and that's your profession. So my first question, maybe for people that don't know, how long should the pressure be held? Secondly, what is the best device besides the finger to get more accurate with the pressure points? Is there something you might use that's common for everyone?
Excellent question, sir. My timing is I do 9 breaths. You're similar to your timing that you would do for your Mupadankum. That's about how long I would hold. You don't need to hold it for an hour. You can press it just for a second. But I like to time it to the breaths, and about 9 breaths feels like a nice, significant stimulation to me. The finger is good for modulating how much pressure, not too much, not too little. Other than that, for tools, sometimes they have like if you find a rounded stylus, if that helps you be more precise, but like with a soft tip, sometimes they have those little rubber tools for tapping on a screen. Something like that could be good. Because actually the guide tube, or sometimes you use it like a pen or something, this might be a little too like sharp edges. You don't want to like leave a mark on the skin as much as you want to get into like the dermis and the connective tissue. That's where you're looking to stimulate. So I'm not sure if that's a very helpful answer, but that would be like an overview. And so if, I don't know, if people want to send me pictures or videos of how they're trying to do it, and I can say, oh, that's creative, or maybe it's a different suggestion.
No, that's great. Thank you very much. Yeah, that way we can see everybody. I'll go to gallery. Let's see, questions. Bonifant. Kilbonim, yes, sir? You're on mute, sir.
Am I on now?
Yes, sir.
Well, I'm Sabanim. Good to see you as always. I got a question. What about neuropathy in the hand? Does that help any?
We have excellent question, sir. We treat frequently for neuropathy in the hands and feet, and there's a very specific protocol, including that Hogu that we just showed, and then there's some other points, some other yang points higher up the channel. And the way I've been trained is there's a specific order you put them in, and a specific order you take them out. So we have some success with neuropathy. There's certain things that are difficult to like completely cure, but usually patients report having some relief for neuropathy. Maybe I just make a little pitch for my profession. I will say acupuncture can treat everything. There's some things we're better at than others, but we can treat everything. And maybe I say like acupuncturists don't wear beepers. So if you have a fracture or you have appendicitis, don't come see me. Now, if you have a headache or you have sciatica or some neuropathy, that's like our bread and butter. Acupuncturists, we treat that all the time. So we're very confident with those sorts of treatment. Thank you, sir.
Kamsahamnida.
Thank you, sir. Yeah, I was looking up yesterday. I thought in the founder's book, and Bonsignor will probably be the person to ask about this. In the Korean volume 1, I have the Korean one. There's not a picture of the pressure points, but I think it's in one of his earlier works. the 1949 book. The founder lays out all the pressure points. I'm not sure the actual date of that book, sir. Maybe you could resource that.
I will take a look for it. Because the founder did primarily four major texts. The first one being Hwasudo Kyoban, because he named its art Hwasudo. The second one is Tangsuro Kyoban, and there's a copy of it in the one of the universities in Hawaii. They actually scanned every page. If you want a copy of it, I believe myself, as well as maybe Bonifan Kyoban, and maybe some others have that digital copy, and we can maybe email it to you. It's a big file.
Yes, sir.
And that one actually, from what I remember, that actually has in the back, that has things like life saving, like if a person is like drowning, or a lot of first aid stuff. So that might be quite interesting to have it in your library at the very least.
Yes, sir. Yeah, I do.
The third one is Subakto Degam. That's the major one that we use, that got converted into English Volume 1 and 2. After that came the Yukro Shiptangum volume, and his last book was the Cholhak philosophy book. So about acupressure points, now I'd have to actually do some research on that and get back to you as to where, if any, which book that would be in. And that's the best answer I can give you at this present time.
Yes, sir. Thank you. Yes, I believe I have that document you're talking about from Hawaii, so I can send that out to people if they request it, or or the link to get to it. Yes, it's very fascinating on life-saving, water tactics, some unusual things that aren't occurred. So yeah, it's something definitely people should take a look at. Brent, Jokyonim.
So in the second document that Monsignor SBN was referring to, it's on page 254 for all the pressure points.
And that's in the document from Hawaii, right? The PDF file?
Yes, sir. Yes, sir.
Perfect. There you go. Well, thank you.
Actually, sir, as a recommendation, I think it would be easier. You sent me the URL for that.
Right.
And probably posting that URL, because it's a big document. There's no way you can email that thing.
Right. Absolutely. Well, thank you.
Yes, sir.
Thank you, everyone. First, I'd like to thank, obviously, our senior leadership for always being here and supporting and guiding us, and to the Kwang Nim for this opportunity to be able to continue to set this program in motion. It continues to grow. Our team here in Zone 2, United States, is phenomenal. These gentlemen, every time we have a meeting, we have a plan. They get it done. Our meetings are done usually ahead of time, most of the time. But there's some really great things coming. So just to let you know, one thing, I was contacted by Sabinem Stephen Diaz, who had a meeting with the Kwang Nim last 2 weekends ago, maybe it was now, and some other senior leadership. And they requested a curriculum for the Silver Mudoan program to be able to attend the whole week of the Kodanja Shimsa as a guest. So based on all the information our team put together, we put together a proposal for that, for multiple sessions per day based on what's needed for these types of practitioners to enjoy getting together and have mutual training and be part of the Kodansha experience. And then also a booklet that will go with it so that they have a guide as they go through the week. This is all a proposal, but just to let you know, this is in the works. This was originally talked about back in 2015 when we originally got together. And so it's nice to see that it's come to that level of things. So, Kodansha is one of those things. If you were able to attend the week, you can do all of it or part of it. This next year, it's in Region 7 in Minnesota, as it was 2 years ago, which I attended. A very nice facility, very easy to get in and out of. So that might be our initiating opportunity to bring the Silver Muduan program to the whole Kodansha week with curriculum that will address all kinds of different things for these level of practitioners. So I wish everyone a very happy holiday season from our team. Whether you're celebrating Christmas or Hanukkah or Kwanzaa, enjoy the time with your family, and it's always good to see everyone here. So thank you, everyone. Let's go ahead and we'll bow out.
주리앗 국기발에 바로 묵형 바로 서범님께 경의에
Smida.
감사합니다, everyone. Take
Thank-
care. Have a good
Yeah.
holiday. Looking forward to seeing you wherever and whenever we get together. Subak.
Subak.
막
감사합니다.
Thank you, Townsend SBN, for your great information, and Cheever for yours. It's good to see you joining the group. We'll be asking you both gentlemen back for even more great insights, obviously.
Thank you, SBN, for the opportunity.
Absolutely.
Honor.
Thank you, sir.
Very nice information. from both of
great
you.
job. Great job.
Thank you.
Hamida.
Subak.